Hello all, in this video we are going to discuss a topic about hysterosalpingography, which is also known as HSG. This procedure is done in the females to evaluate the female uterus, fallopian tubes, ovaries under fluoroscopic guidance by injecting a contrast media into the vagina through uterus. Okay, so the indications are as follows for this procedure. Main thing is infertility. If the patient is having any infertility or recurrent abortions, congenital anomalies of the uterus, post-operative evaluations, for example any tubal ligations or reverse tubal ligations. Next thing is suspected case of genital tuberculosis, and another thing is to prove, to ensure that if the patient after insertion of any trans cervical sterilization micro insert, we have to ensure that any particles or any compounds have been will get settled inside the uterus. So we have to ensure that it has been cleared. So this procedure will also be done. Okay, contraindications are as follows: suspected pregnancy, acute pelvic infections, active vaginal bleeding. If the patient is having any recent DNC procedure, immediate pre and post menstrual phase. If the another thing is if the patient is having any tubal or uterine surgery within any 6 weeks of the procedure of the appointed date, and the next thing is contrast sensitivity. So these are the contraindications in which this procedure will not yet be done. Next thing is patient preparation. This procedure is done in the first half cycle of the patient's menstrual phase, in the days of from between the days of 8th to 12th day. And the next thing is the patient is asked to avoid unprotected sexual intercourse from the date of a period until the investigation is completed. The next thing is, if the periods are irregular, the patient is asked to take pregnancy test to confirm whether the patient is pregnant or not. Next thing is, if the patient is having any pelvic infection, active pelvic infection, this procedure will not yet be done. And after thing is, antibiotics is most probably not recommended for if the patient is undergoing any antibiotics. The patient will ask to stop for it before 2 days of the procedure. Next thing is equipments used. Contrast media. Contrast media doses are water soluble contrast media is most probably used. Urographin 60%, Contrary 280 mg and Trivideo 280 mg. Volume will be of 10 to 20 ml. Equipments used are an open-sided speculum, tenaculum, sponge stick, antiseptic solution, contrast medium, a cannula, a balloon tip catheter, and gloves, gauze, lubricant jelly are the equipments which are required for this procedure. How the procedure is done is, before starting the procedure we have to inform the procedure to the patient clearly, and we have to get a consent we have to get a signature from the patient in their consent form, and antispasmodic is given before the procedure. Next thing is the patient is asked to empty her bladder before starting the procedure, and the patient is asked to lie down in a lithotomy position under the edge of the X-ray table. Okay, after that a speculum is slowly inserted into the vagina through the vagina at the anterior lip of the cervix, which is held with the tenaculum. After the tenaculum is inserted, a gentle traction is being given. After the gentle traction is given, and we have to ensure whether the cannula is get introduced into the cervix or not at the anterior lip of the cervix. After ensuring that the cannula is placed, we have to insert a cannula into through the cervical canal under a direct vision. After the cannula is inserted, the speculum is removed, and the patient is moved up moved up the to the exit table carefully in the supine position. The patient can retain from the ureterotomy position. The patient can be in a normal supine position. Care must be taken to remove all the air bubbles. So if any, we have to ensure that whether any air bubbles have been remained in the syringe or not. If any air bubbles are there, we have to remove all the air bubbles and the cannula before inside the cannula before injecting the contrast medium to avoid fibroid like structures or any mimic polyps. After that, under fluoroscopic guidance, 2 ml of contrast media is injected into the outline of the uterine cavity to prevent the leak from the cervix. A downward traction should be given from the tenaculum. Okay, so when the tenaculum, when the cannula is in the straight position, is in the if the cannula is in straight position while we are injecting the contrast, what the contrast will get, in the sense the contrast will get leak out, there might be a chances of leaking of contrast from the cervix. So what we have to do, in a sense, we have to give a downward traction to the cannula to keep so if the tenaculum is in downward traction, the cannula will get upward pressure and the contrast media will not get leaked from the cervix. After the injection of the contrast, the patient we have to ensure that the contrast is contrast reaches the interperitoneal cavity, is visualized. The 3 ml of contrast is again introduced into the uterine cavity, and another 3 ml is injected into the uterine cavity through the tube. Up to 10 ml of contrast media is injected. Spot films are taken at AP projections. So after spot films are taken, after the end of the procedure, an antibiotic course is given to the patient, and the patient is informed about any vaginal spotting for 1 to 2 days. So what they will do, in a sense, this is how the procedure will be done, and after this the patient will be given such a care, and the filling of contrast media will be visualized in such a way. So cannula is in the downward traction, and the uterus and fallopian tube and ovaries are filled with X-ray dyes. So this is how the X-ray images will be visualized. So how they will take the filming techniques, and they'll take the films in 4 images, like in 4 ways, like half in the timed intervals, like how means to demonstrate when the dye outlines the uterus, outlines the interior surface of the uterus. Image 1 is taken. After that, filling of the fallopian tubes, image 2 is taken. After that, potential spilling of dye into the peritoneal cavity, at that time film 3 is taken, and after that, the fimbrial end of the ovaries, another film is taken. So 4 films are taken, 4 images are taken. So the images will be visualized like this only. After that, the patient will be given a care. So we have to ensure that the patient is have no any serious discomfort before she leaves the examination room. She must be cautioned that she will be having mild bleeding in her vagina for 1 to 2 days, and for mild pain, analgesics will be given. So we have to give a proper care to the patient, and we have to leave her from the examination room. Complication is nothing but the patient will have pain, infection, bleeding.